Thank you very much for listening to this talk on data-driven identification of diagnostically useful extrastriatal signal in dopamine transporter that SPECT using explainable artificial intelligence. My name is Mahmood Nazari and I'm giving this talk on behalf of my colleagues listed here. That SPECT is widely used in the diagnostic workup of patients with clinically uncertain Parkinsonian syndrome. It provides high diagnostic accuracy of about 90%, and it results in change in management in about 40% of the patients. Visual interpretation of that spec is primarily based on tracer uptake in the striatum. And semi-quantitative analysis of that spec to support visual interpretation usually also focuses on the SPECT signal in the striatum and striatal substructures such as the dopamine. However, there is increasing evidence that extrastriatal signal in that SPECT that most likely represent binding to the serotonin transporters rather than dopamine transporters provide useful information for the differential diagnosis of neurodegenerative Parkinsonian syndromes and as functional correlate of non-motor symptoms. The aim of the present study was to test extrastriatal signal in that SPECT for differentiation between neurodegenerative and non-neurodegenerative Parkinsonism using a data-driven AI approach. The retrospective study included a total of 1,306 data SPECT from clinical routine. About half of these data SPECT showed reduced striaton tracer uptake according to the retrospective visual inspection. The other half showed normal tracer uptake. For the analysis presented here, SPECT images were left-right flipped such that the striatal tracer uptake was lower in the left hemisphere in all cases. A two-step approach was used for identification of useful extrastriatal signal in that SPECT. In the first step, a convolutional neural network was trained for binary classification of the data SPECT. The network was composed of 4 3D convolutional layers followed by 3 fully connected neural network layers. In total, 230 million trainable parameters without max pooling and few filter size were trained. In the second step, after training the network, layer-wise relevance propagation was used to compute the relevance map for each single data SPECT. The voxel intensity in the relevance map indicate the relevance of these voxels for the classification result reached by the network. The layer-wise relevance propagation operates as 2 steps, forward pass and iteratively back-projecting the relevance. In the forward pass left image, the amount of contribution of a neuron in the lower layer to the neuron in the higher layer is calculated, in this case from I to j, and in the second step, right image, the relevance with the same amount is back projected from higher level neuron j to lower level neuron I. Relevance starts from the most activated neuron in the output layer. A mean relevance map that we call heat map here was computed by averaging the individual relevance maps over all correctly classified data SPECTs. 3 different settings were used for network training and layer-wise relevance propagation. First, full SPECT images. Second, only the region of the striatal cropped from the full SPECT images. And third, the full SPECT images without the striatal region. Here are the results for the different settings. The heat maps are shown in the bottom row. The convolutional neural network achieved very high accuracy in both the full images and the striatum-only setting. The left dopamine was most relevant for the classification as expected. In the setting without the striatum, the network achieved 70% accuracy, considerably better than random guessing. Highest relevance for classification in this setting was observed in the left temporal lobe and in the pons. From these findings, we conclude that extrastriatal signal in the data SPECT provide moderate accuracy for the differentiation between neurodegenerative and non-neurodegenerative Parkinsonian syndromes. that is mainly driven by the pons and the temporal lobe, but that extrastriatal signal does not provide additional independent information beyond striatal tracer uptake. However, extrastriatal signal in that aspect might provide independent information if the striatal signal is compromised. That is, for example, the structural region. This might be tested in the future studies. With that, I thank you very much for your attention.